sensor network is a tool that can provide our environmental monitoring and multi-parameter system analysis. And actuality of this topic also is driven by the market in such areas as ecology, agriculture, industry, and it's critical in areas related with safety. For example, healthcare and security system, where timely receiving of the message and some data can save lives. Our objectives is, of course, to continue our previous studies, develop, assemble, configure, and test a prototype of ISM, wireless sensor network, and to integrate our sensor node in this network and to make some tests. A comparative analysis from previous studies showed that mixed or mesh topology combined with MQTT protocol provides us flexibility and reliability. Also for energy efficiency, we used BLA technology and FSM algorithm to switch between operating modes. It's one active operating mode and three passive. You can see a table of consumption of each state. On the next slide you can see a block diagram of our sensor network prototype. The main node in the center is access point and MQTT protocol. It communicates with peripheral. It's peripheral nodes that obtain data from environment. Also, this central node transmits received information on the display and data showed in real time. As power source, we used rechargeable battery. Maybe in the future we will explore alternative sources, as for example solar panels. And here assembled network prototype. You can see several nodes and central node with display when the data is showing in real time. Our system is flexible. You can add and remove a node in operating in working time, and you can see the data from sensors showed as for current sensor, for resistive node, and the other multifunctional node. Here power supply is a power bank. And on integration step, we faced with a problem. So we have our sensor, and it operates. It can be heated to 250 degrees for normal operation. So we should fix it on our board, but we also should connect it to the heater. And the closer we receive measurements, so we should place contacts more closer to avoid parasitic effect. And to resolve this problem, we designed a substrate. It's a protective substrate from heater-resistive material, and it protects our electronic part from high temperatures. we reduced material consumption, and it doesn't affect on safety, because air is also good isolated. Here you can see assembled sensor node. We used UV radiation source to make some tests. Also you can see dimensions of our node. It's quite small. First test, it was semi-ingenation. It showed homogeneous of the films. That means that technology works quite good. Next step, dynamic sensor response showed fast response. Also for 0 and 7 volts we received about 7 milliamps, and it indicates that at 250 degrees resistivity for the sensor is 100 ohms. Also we receive current voltage characteristic, it's linear, and it's very good result for future management. So we developed, we assembled, we configured and tested our network prototype. We integrated a sensor node in this network. For reducing dimensions, we used nanosensor. For sensibility, it's also very good. And we made several tests for our nanosensor integrated in a sensor network. Our system compatible with different nodes because you can connect other nodes, and it's quite positive results for future studies. As future plans, we should identify one of future areas. We should improve our sensor and our network and test in different environmental conditions, maybe with larger quantity of sensor nodes. And I would like to thank organizers of this event, committee, and program was supported by LEFTEC. Thank you for your attention. Thank you for questions.
Thank you for your presentation. If there are some questions, any questions? Okay, I'll put a question. What broker of MQTT did you use?
We used different brokers for testing.
Yes.
We on this step we didn't know what we can use in the future, because it depends on future area. We should firstly identify exactly what area we will use, and we can define exactly what broker we will use.
Okay, and I saw that you use an ESP32. Did you try to send data to a cloud server?
Yes, we use Wi-Fi, and we can transmit data on the server, but it's on study of building.
Okay. I can give you an idea. You can use Home Assistant. If you have a broker with MQTT, Mosquito for example, and you can store the data, and it's very simple to use it. Okay?
Okay, thank you.
Welcome. Now we'll go to, thank you. We'll go to the next paper. Take a moment. Medical University Biomarker, de Advanced Sustainable Național and Global Research. Elena Romanenko.
So this is a totally different topic from previous one, but I hope will be raised by interest for current or future research because we represent an infrastructure for the future or current research. So my pleasure to present to be part of medical university to represent today medical or university biobank. Before to start our discussion, just I want to highlight what does it mean biobank. Biobank is a legal entity or part of a large entity that performs biobanking. But what does it mean biobanking? This is a process for acquisition, collect, and all related activity to these functions like storing, transportation, testing, and data related to these samples, specifically for biological samples. So biological samples could be human, could be animal, or microorganisms. Different. And here, I think we can join our effort, just to before highlight, we can join our effort for biobank because, you know, physicians are more proficient on patients, on microbes, but less proficient on technical infrastructure, on information systems, and in this case, interdisciplinary participation would be nice to involve our research. And also key aspects for biobanking is like ethical collection and informed consent, very emphasized on this currently. Secure storage and quality control, so we have to ensure the quality control of our well-defined and qualitative biosamples. Data management and protections related to our national law of data protection, GDPR, from European countries, and research support. Is biobanking relevant today? It's like an extract for this paper. We can see the elevation interest in biobanking through different years, and specifically biobank topics related to this is cancer, consent, so again ethical conform, and biomarkers. Yesterday, I just searched again for PubMed, and you can see again an increasing interest of publications in biobank. So, even at 9 October, more than 6,000 publications related to biobank. So, in this case, we can consider as a relevant topic of discussion and relevant topic of research and implementation. Just to highlight that we can have different type of biobanks, but in relation of medical institution, we can divide between treatment and diagnostic and research biobank. So I think many information, many news about cell stem collection, about transplant collection. In this case, we have currently differentiate between treatment biobank and research biobank, which are regulated separately, and we have different guidelines on this. And in relation with research, the most important part of research could be started from the university. So university should be a promotion of research in this field. And in this case, university research and development biobanks can be a benchmark of any other research in this field, which can provide benefits for all research, like high quality specimen, well characterized for clinical and research studies. As I mentioned, we just not develop biobank as I want. At the international level exist standards specifically for different type of biobanks. And in this case, we have specifically for treatment and diagnostic biobanks, and we have specifically standard for for research and development biobanks. And we are focusing on these standards, and we'd like in 2, maybe maximum 3 years, we have an accredited biobank according to these standards, and also a new researches. And the question, does it existing regulation and governance of biobank can be ensured about this quality, about these procedures? 2024, biomedical governance was suboptimal and unclear. A lot of confusion used and misleading information for medical staff and for community. We can have biobanks, we can collect, we cannot collect. And in this case, today, in Republic of Moldova, you can consider that we have strong regulation of biobanks, both for drug treatment and diagnostic and for research and development. Practically, we can consider one of a few European countries with such strong regulation at the moment. Less in governance, but regulation is, I think, is always. Like, we have a national law of biobanks, we have a national law of transplant, like treatment and diagnostic, biobank, and most recent development is a framework regulation, even yesterday, or today is approved by governments, like framework regulation of biobanking, both for treatment, separate for treatment and separate for research. So in this case we have all total regulation umbrella to establish, to implement, to develop biobanking procedure in Moldova for biological samples. Even for treatment and diagnosis, if we'd like to join such research or such activity, and also separate for research and development, if our colleagues are interested in research and development. As I mentioned, this regulation provides legal frameworks to strengthen the capacity of national university research biobank, like give us an umbrella to continue our activity. But we didn't wait till this regulation and laws were approved. We developed our activity, we started to develop our activity several years ago. And in this case, the first activity, it was to do a gap analysis, like methodology which we used in our research. It was to conduct a gap analysis, like a SWOT gap analysis, to see the weakness, the good parts, and to develop a roadmap for the future establishment, for future improving of our biobank. We focus on 5 pillars, like governance and stakeholder engagement, quality and regulatory alignment, infrastructure, staff, and accreditation readiness. And currently, today, we can consider what we already, after conducting our gap analysis, we obtained already some results, like establish partners and stakeholders, collaboration with local and international groups, and also biobank, university biobank team is like members of Ministry of Health working group for biobanks. We establish, let's say for current we have a good infrastructure for current university biobank with dedicated areas, dedicated facility, with dedicated freezers, other tanks, backup powers, and barcode-based facility and environmental and access control system. We also designed this for scalability and national integration. Regarding data management, as I mentioned, yes, physicians are less proficient in technical skills, but we need such database. We need well-developed database for national biobanks. Currently is under developing and would be a joint national database for transplant agency and together for research biobanks. First of all, we should know that this data base should be linked with our national law of data protection, personal data protection, and GDPR, European GDPR. We can consider that university biobank is a young but promising scientific resources. Yes, and also our vision, our future is like feasibility study when probably, we hope as soon as possible, should be start the renovation of National Institute of Health with dedicated floor for national university biobanks, which we consider will be, like a good example of research infrastructure. And as I mentioned, young, but with a mission, with developed mission and with a good vision and goals. to align our biobank to standard, international standard, and to European Research Infrastructure Consortium, Viorel, which is specifically for biobank in research and development. So we'd like to be as a member for this European structure. And also our goal is to strengthen national research capacity together in collaboration with all our partners, not only for medical university, but also for local university and international university. And more complicated and more gaps and more lack of knowledge on this is like to issue ethical governance and data integrity and long-term sustainability. Research area, which can be also interesting for present and future research, molecular genetics, epidemiology of non-communicable diseases, cancer biomarkers, infection diseases, genetic and environmental factors influencing health. And here, yes, as I also mentioned, physicians are good for patients, for samples, but less good for technical support and database and information systems. So in this case, we can join again our information. Because benefits for research could be both for university medical, but also for our partners. Biobanks can provide well-characterized qualitative samples and data for research subjects. So it means we have samples, but also we have data related to these samples. Of course, again, according to law of data protection, anonymized or codified. And in this case, also biobanks, research and development biobank can provide support for publication of scientific papers, and specifically, currently, now, to contribute to personalized medicine and innovative therapies. Because permanently we can provide, yes, in future currently is like a young, but biobanks can provide well-characterized and qualitative samples even for research, if it's research and development biobanks, or for treatment and diagnosis, if it's transplant or cell biobanks. Yes, we conduct a lot of efforts. We implement a lot of efforts to obtain already some results, but of course we face some challenges. First of all, low awareness, as I mentioned in previous slides, misleading information, unclear, confusing news, and in this case we have to raise health literacy regarding banking understanding. Regulatory gaps. If I mentioned, we already can consider that regulation is already established. Now we have to establish governance. Who will be responsible to monitor and supervise biobank in Moldova? In which manner, what ways? And in this case, already, even under regulation of government, we have to establish a national coordination body which will monitor biological biobanks. Fundings. Of course, this is a permanent problem, but if you are trying to do something, if you are active, proactive, in this case you can find new partners and stakeholders for this. But in any case, we can again join our efforts for this. An ethical issue, permanently debate about IFB or ethical or informed consent, should be general, should be focused, what kind of information, how to store, and so on. But as I mentioned, we have clear direction. Currently, during the next 3 months, we have to establish a national biobank coordination body. It will be established under Ministry of Health and Medical University, which will coordinate biobanking for research and development, to develop and finish database together with National Biobank Registry, to harmonize ethical framework to ensure long-term fundings, and also to become as an observer or to obtain observer status of European Committee of Research and Diagnosis of Biobanks. So we would like to continue and to improve our activity on this field. As a conclusions, we consider that biobank governance in Moldova is now more clear and better regulated. The National University Research and Development Biobanks operates within a formal legal framework, and researchers have access to valuable samples, well-characterized and qualitative biological samples. And also, University of Biomedical provides support for publication. And as a goal or vision can be that your university biobanks can serve as a benchmark model for our regional university or for our regional country. Thank you for your attention.
Thank you for your presentation. If there are questions, please.
Yes, I have a question. Thank you for your presentation. It's a really nice project. We like it. We saw that you are working on the environment of the team, and we would like to ask you pointers about the databases. You want to use a already developed one, or maybe you want to make your own? Which key points you can say, for example, to implement AI, maybe because you have data is related to AI?
Yeah, good question, because it's also tricky situation with database even in our country. But not only in our country, at big houses, the same situation. So I joined a medical university 2 years ago, but before this, transplant agency started to develop a database for transplants and the donors. In this case, currently the situation is, even for research and development biobanks, will be as a model or linked to database for transplants. It's okay, could be debated this, but this is the current situation as to use the current infrastructure and situation. But in the next period probably could be a separate model, but also could be a separate maybe database. It's a new developed database in the country. During this time I discussed with many international experts, and they permanently told that please don't start to create a new database, because it's take even from Institute Pasteur, they started to create the proper database, and it took a lot of time, a lot of we know how to create. But the current situation existed resources, existed project for developing a new database for the country. We'll see. It's under developing, and we have a continuation of this project, and I hope as soon as possible to be also manageable for even transplants, donors, and also for research and development. Future, maybe I am for the separate model for research and development.
Thank you. Yeah. Oh. Thank you. We'll go to the next paper, development of smart platform for managing medical environment, Daniel Tirke.
Hello everyone. I will show a project, and what will be shown in this presentation, it is like from where came this idea and how it was implemented. Because normally in research, how it works, you have your supervisor that is like pointing some ideas, or you are implementing already existing project, you're starting to work, but it is not our case. Our solution comes from the medical institution. One of our researchers is working there, and what he has shown there is that their database is old, is on the paper. It's not tracking the time that the drugs can be used, to manage it in a way that less drug will be left to the trash, and then we have to buy more and more. It's not counting which material need to be buying for the next year, because normally when a pandemic is coming, you don't know it before, but you have already some data that shows that some of the material is slowly increasing, but most that wasn't the last year. What was our ideas, how to implement it? We have some key points as to make a low-cost prototype, a device that can scan the barcode from the product that we have. We can print our own barcode to stick it on the product. Also, we will track the temperature and the humidity for the drug that can be stored at the low temperature. We have designed our own database to have it inside, to have the control about the data. We have chosen mini PC. In our case, it is a Raspberry Pi, but it can be scaled if the project will be scaled. Also, the smart alert that will read the data, will make analysis, and will show some advice. The second idea was like why to develop it. Maybe are already some companies that is doing that, how it is looking, why to do it if it may be already done. So what we have seen is a company, a startup of more that is called Hector. They are using the smartphone to scan the barcode, to add it in database, and then to have a nice app of the stock that you have in your medical center. Then is our two apps that is only app. We do not use hardware. You have to do it by hand. And then it is time related and not really efficient. And then how it is done now, like there is sheets where you have to fully complete it and then print it as paper and go to put the paper to the store that you have. So as I said, is it really neat? And we say that yes, because the really new startup, as I said, Hector, they have already between 55 and 60 employees in North America, Europe and Asia, and their estimated annual revenue are about $10 million. What we have chosen for our devices is ST266 with YOT connectivity, AIT, Internet of Things. We have Bluetooth, we have Wi-Fi, we can connect with them temperature and humidity sensor, and also the scanner for the barcode. What we can then store in the same place where are the drugs, and then we will see on our second monitor the temperature in the place where they are stored. What is the key parameters is that we can measure the humidity with the air of 2%, and then the temperature between 0.3 degree from a value of -40 to 125 temperature degree, Celsius degree. Then the first scanner can scan like 200 scans per second. We have a camera on our Raspberry Pi that can also be used as a scanner. We have our Raspberry Pi that will have a screen with the 7-inch and a touch screen that can also be used, but it is normally placed on the desk of head of the medics, and he is seeing how the other is scanning the devices and making the supplement, or maybe using some drugs that is already stored there. Then, I mean, it's not enough to have only the devices. You must have an app where you can check. It's easy to understand. It's for the people who don't really have used it before, and it will be intuitive. So we have added as key points to be automatical. It means in parallel can be used more devices, and that automatically will be added in the database. Multiple users, and then it is flexible architecture. What means, for example, we have done it for a medical institution. We can adjust for our industry. Maybe instead of temperature and humidity, it would be nice to have some other type of sensors. And as technology was used, HTML, CSS, JavaScript, PHP for server side, and as databases was MySQL. How it is seen right now? We have the user interface, where are shown the quantity of devices and where are they. The admin can give an accept or not if the product that was bought and is arrived do not correspond with what he was asked. And here are the logs, for example, at which time, what was added, in which quantity. And here are the product interface, where you can see the time when he will expire, the temperature what he must be stored, and based on this information, it will also take care about in which room it stays and if the temperature corresponds with needed one. So how it looks here, we have the prototype, the scanner. You also have a screen, we want to touch screen, that means you press a button, you scan, and it automatically is added. And then you have the physical device that stays on the table and shows you how many. But we understand that it will not be really comfortable for a medic to use it, because you have to make like reports, you have to add, buy more, you have to delete something, and because of that we also have designed the app in that way that it is verbal, so it can also be used from the phone, because normally we know that the medics are on the hurry, they have to run from one room to another one, and you don't know when will be the moment. Maybe you have to do something, but you also have to buy something in the same time, so you just open your phone, you look what you have in the stock right now. If you need something more, you just add it. Or if you forgot to check it, the app will show you a notification on your phone, and then you will know, I need to buy some more paracetamol, for example. So as a conclusion, our app already is used in the clinic. It is in IFMBE. It has more than 1,200 items, and it automates the buying process, where you can know from a previous moment that you have to buy more of, and it will show what. So I'd like to thank you for your attention, and if you think that this device is useful for your area, or maybe you know somebody who can use it, please contact us. We will be.
Thank you. There are some questions, please.
Just I can propose our facility to validate your application, because it's really tricky inventory in a medical facility, even laboratory, different other. So in this case, welcome.
Thank you very much.
My question is, you have already released the product, or it's a prototype?
It is used in the medical institution in IFMBE. There are like
Registered? Is it registered?
it's in the test. Like our colleague is working on logistics. He already do it on Excel, and to automate it, he have driven into this app. But it also make the reports, PDF reports, that is already like automated, and you just have to sign it, or from your phone you add the quantity, then you print it and sign it. It's easy to.
No, I really a nice tool. Just another question: if I see that you are going to integrate, but you know in medical facility exists another many other database, and how can be this linked? I don't know, with account database, just to monitor entrance using the exit. Or it's a future.
As I said, yeah, we have this device. I mean, when the product is coming, we are scanning, and it automatically comes to our database.
Okay, good.
That is why we choose the hardware solution for this, to have control the exact quantity when it is coming, and then you can easily go to the storeroom and check on the device. If it do not correspond, you have a question about where it is.
Okay, thank you. Really a nice prototype in the area. If you need it for validation, we are welcome.
Okay, thank you. Any questions? I have a question. If it was a question, I think, for physician part, I will ask a question for medical engineering part. Did you use this application is for very good for medical engineering from the hospital to refill and to know what are the stocks in the hospital? But did you use an algorithm to calculate and to to say when it's time to do a refill for this medicament or for this.
Right now it is
Simplify
like,
the work of medical engineering also.
right now it's like just based on the simple question if it is less than 10 or if it is more than, and it shows you other. But we're planning if we can integrate or maybe make a partnership to integrate AI, for example, as ChatGPT, because they release the tokens to use it on your local or maybe to download already trained database as DeepSeek because it is already on GitHub, and to have it on our local device that will not be related with the internet, we will not lose the data, and at the same time he will make for us the analysis and will show the maybe predicted.
Yes, because some stock is more used and other ones is less, and you cannot put a line to say all of them if under you have a problem. No?
Yeah.
Yes.
And I have another.
Yes, please.
Just another question regarding this. What is your advantages comparing to existing already softs? Because we know that exist many on the place. I have tried different one, and yeah.
We also was thinking about this, and our advantage is that we can physically control the environment. We can physically scan it and have it like the other platform is just like you have by your hands to enter the stock. You have the data inside, but here you have the device that is doing it, and you also have the condition at which temperature and humidity it is stored.
Okay.
Thank you for the presentation. We'll go to the next paper, modular mobile robotic platform for smart city and indoor service application. I think it's presented by me. The context and the object, we'll see the robot is more and more in our house, in our education and delivery, health and so on. So we develop a platform for integrated robotic in the smart city. Our platform have 3 layers, drive layers, control and sensor for moving in the city. For driving layers we use 2 motors and a driver for these motors. The main idea is, you will see it is a small one, but this one is the brain of robotic. You can change the platform because of that is very modular. For example, if you want to make it bigger, you only have to input a different driving controller to have bigger wheels. For controlling, we use Raspberry Pi platform, and we use ROS. ROS is a robotic operating system. We use this platform for controlling the robot and to driving autonomy. The sensor part, we use 2 front sensors. They are to not to enter in to not get out from the stairs, and also we use LiDAR. What is LiDAR? It's a laser point radar to navigate to the room. We built where they have module in ROS to make simulation. We added vector lines for robotic to align it. simulate different situations in different scenarios. We simulated this part with gazebo. We built our facility, and this is the robotic what we built it. And we embark a different model of scenario to scan. This is the experimental part. Here we see what the robot is seeing. The white one, the white part is where the robot knows where to go. He can go from there. With the green part, it's unknown, and if it's black, like here or here, it's he cannot go near to that. Also, we added a convolution part because if you go back, I think here, we see the center of the robot is not in the center of platform, it's between these two wheels, and because of that, from here to here is 20 centimeters, and if the robot go near to the walls, if he turns around, he doesn't hit the wall. Here we see the real time, what the robot is seeing. This is the front of the robot, and here we calculate the navigation part with Monte Carlo algorithm. If there are an additional obstacle in that part, the algorithm will calculate another route to go to his destination. In conclusion, the advantage of using this type of platform is modular. You can embark different types of application on this robot, and he can change automatically his job. You don't have to have different robots or robotic platform for different mission. For example, in hospital, if you have a type of this platform, our robot can change from sterilization robot. He can embark the part of sterilization, going room to sterilize each room. And after that, he can go and take the platform for example, for security parts, to go around the hospital to make sure that no one enters in an area that doesn't allow. Or he can change in the day to be a reception or triage. I think this is robot. Thank you for your attention. There are some questions? Please.
Maybe because I'm not a technical person, is it designed also to carry some products?
Yes.
Again, and link
This
some
one-
laboratory and the clinical settings.
Yes, this one is the small one, is the brain. You can carry it, and after that you can put it on the bigger platform. For example, in the pandemic, I was going with my colleague racing with these robots in the faculty, and we changed the platform to carry us. And only you have to output the small wheels and to put the bigger wheels. And after you put the bigger wheels, the settings from simulation part, they change the design to be bigger.
Because big hospitals, they need laboratories for prioritization. I don't know if you can see for big laboratories.
Yes.
like a system of proposition of samples from
Yes.
hospital. And I see as a robot's more
Yes.
easy to use. It has to do with underground.
Yes, they can carry and mail,
in this case.
for example, to mail it from the
Could be
different part
inside
of
the buildings,
yes.
but also between buildings.
Yes.
Could be.
Yes,
But
also have
should be
GPS
infrastructure
and
like to avoid such nivellation.
yes, I think 5 centimeters. Yes, but we can adapt our robot to. There are some robots to take stairs up and down, and we can adapt. This modular robot is why is it modular? Because you can adapt the
Because I can see as a check
scenario.
environment, how well was cleaned or something,
Yes.
but also the carry of some small products like biological samples or papers.
Yes. Thank you.
Is LiDAR probably for triangulation, right?
Yes.
Okay. Could you not substitute proximity sensors, because for hospital type of environment, I don't work in hospital, but maybe if you have proximity sensors, I think that would be much
Yes, we have also proximal sensors, but for more precision, use LiDAR. Yes, the problem with the LiDAR is in open space.
Right.
But in open space, we use we change from LiDAR to GPS.
To
GPS.
oh, GPS, okay.
To position it, and after that we have also sensors for proximity and also sensor for steps.
Now, for smart city project, I have drone where we have not only LiDAR but also hyperspectral imaging. So we could do lots of little things.
Yes, we want also to make a VSLAM with video. Our robot have also video, but we didn't manage until now to make and also VSLAM, only LiDAR SLAM. Classic. Thank you. There are any questions? No? Thank you. We'll go to last paper of our session, multi-agent decision support for sepsis, balance precision and hallucination risk in biomedical engineering.
Hi everyone, my name is Viorel and I'm the last in the list there, representing two institutions, Technical University and Medical University. My colleagues after in the list are either from one of these institutions, and I will be presenting something that indeed is interdisciplinary. First of all, because it involves two large areas like IT and medicine. Speaking IT field, it's closer to software engineering. Speaking about medical field, it's closer to intensive care, because sepsis as the condition that is under attention, here is the intensity is the one that is taking care of this patient. I will start with a list of key aspects, general list. First of all, sepsis, quite serious condition. There will be a separate slide describing this. Large language models, meaning first of all transformer-based models, well known nowadays. Multi-agents based on such LLMs, relatively new approach. Triple augmented generation as a mean to fight, in our case, a mean to fight one of the serious problems with large language models, including using them for multi-agents, namely hallucinations. And hallucinations are the last in the list, although it's not really hallucination, it's more confabulation if we use the psychiatric terminology. But for our discussion, it does not make too much sense. Now, key aspects from a medical point of view. Sepsis, a life-threatening condition, representing a dysregulatory response to the infection, representing a burden for all healthcare system present on the globe. There is a problem with this condition because every hour of delay with the treatment, first of all, antibiotics, will increase the mortality rate by 7 to 9%. So it's important to do it on time. Multi-agent system are increasingly used in different fields. What I will be presenting is more or less new concept because there are other agent approaches, including agent-based modeling. This is something else. And the complexity of sepsis make the use of these technologies quite appropriate. And let's see how it looks like. I will start with some ancient times when magicians and alchemists had a dream to create anthropomorphic being, human being, or anthropomorphic beings, and here we have two examples, the golem from Judaic culture and the Frankenstein from European culture. The idea is that in the modern era we are closer than ever in doing this. And here on the left side we have an image, by the way, AI created image representing large language models. Below is a list of the most common large language models. On the right is their performance on specific tasks, including mathematics, and similar is the beginning of this year. You can see that some area are close to 80 and over in terms of performance. Speaking about the system discussed here, represents a system consisting of 3 agents. On the right you can see the schematic. Below is some code. In fact, it's not displayed to the user, but the one who is doing this may be interested. Describing how these agents communicate between them while solving a certain task. And here we have 3 agents: service management agent that provide literature-based using retrieval augmented generation concerning sepsis applied to a certain specific patient. Next, antibiotic recommendation agent. Here we again the field is quite structured. There are quite clear rules when which antibiotic to use, and finally in this field there exist guidelines. The last one is from 2021 recommending what should be done, or the correct way of doing things for this group of patients. Speaking about agents, these agents in fact, as I mentioned, are LLM based. And what they represent here are certain aspects. The first column, roles, goal, backstory, even backstory, because they need to know who they are to perform the way we need them to perform. And the tools, you can see the retrieval augmented generation is used by every agent. Sepsis management agent, next column in the middle, antibiotic recommendation, and guideline compliance agent. Here is just for your information, some code is Python, as you can see, and code. You can see here is what was in the table. For every agent is defined the goal and etc. Okay, Here about retrieval augmented generation. Let's suppose that the user has a question on the left side. Before passing the question to the LLM, according to this approach, the first will be searching in a previously created vector database with, in our case, literature concerning sepsis, and then adding what was extracted from this database to the query that will be passed to the LLM, and based on this, the LLM will generate the answer. Here is a more complete scheme of this. On the right side, upper part, we have the agent. The user question, the agent receiving, then addressing the query to the vector database, extracting the information, combining, and passing it to the LLM. Speaking about the data used in this research, it's about 10 sepsis cases from an open source database, open access database, namely Unit 4. Each case was formatted as a clinical vignette. You can see the table below with diagnosis, demographic, vital signs, laboratory, etc. And this information is being passed to the model, to the agents. Here is a list of the main tools used. First of all, the LLM used in this case is Palmyra Med, one of the latest and probably the best in this field, specialized medical LLM. Next, for creating the databases to be used for RAG, Chroma platform is used, and one of the embedding models present on Index. And the programmatic evaluation was performed for the answers provided by this multi-agent system using the TrueLens platform. Additionally, with two human reviewers, intensivists with more than 10 years experience in the field. Everything was organized or is organized as a software. Testing is the one. The platform, software application available. The code is on GitHub. If someone can play with, want to play with, and is also available on Hacking Face. After sending a request to the author, to me, simply because it is powered by a large language model, namely GPT 3.5 Turbo, that costs, and I cannot make it accessible for everyone. This is the problem. You can see here the same area to input data as in the vignette. Diagnosis, demographic, etc. After this pressing this button, the information will appear here to be checked, and if everything is okay, requesting the recommendation. And here we have two of the agents, the sepsis management and antibiotic. Below, believe me, there is the third. The user also can check two versions, longer, regular answer, meaning long answer, and a short answer, short version of the answer. So this is how an answer or recommendation look like. Is the same case was presented in the vignette. You can see upper left panel sepsis management recommendation. On the right is antibiotic, and below, after analyzing first two recommendations, the third agents will issue a statement concerning the compliance of this recommendation against the guidelines. Here is some evaluation results. The last column is performance, but first two is about groundness, answer relevance, and context relevance. As I mentioned, the evaluation has been performed by a programmatic approach and two human experts. And here, the yellow color is the programmatic evaluation. And next to green and blue by two experts, you can see that there is some inter-rater disagreement. Not very large, but still exists. Here is about the output from a slightly different point of view. With red are denoted cases when hallucination had been observed. So what we have here first, all the rows represent the 10 such cases with short description, first column. Second column is one of the versions powered by Palmyra-MED, or the main version. In the middle is the one powered by GPT 3.5 Turbo, and the last one is the same GPT family, but a newer model for only. You can see that for some cases we got hallucinations. First case, third case, and last two cases. In fact, the last case, all of the models generated hallucinatory recommendations. They were not very critical, but anyway, they are present. With yellow color are denoted cases when excessive information, not necessarily for managing a particular case, was provided. And as a conclusion, it looks nice. It looks nice, and take into account that many medical specialties mean teamwork. Here we have a situation when we have a virtual team consisting of 3 virtual entities, 3 agents. And the perspective is seems to be quite nice, but at the same time there are problems. And first of all are the hallucinations. Simply meaning that for the moment we still cannot switch to the completely automatic way of dealing with a certain case. And we have to preserve the human in the loop approach. In fact, that's all I was going to present. This is part of a larger research. It's a postdoctoral research project implemented at the Technical University of Moldova. That's all. If there are questions, I will be glad to.
Thank you for your presentation. If there are questions.
I'm not in medical field, but I like your presentation. I have a very simple question.
Please.
The Adochiei retrieval
Augmented generation.
Generator, is that open source?
Yes, of course. Yes, and it's not new.
Oh, no, right, completely.
Yeah, it's open source. There are different platforms.
And you showed the codes, so that's generated by LLM?
Yes.
Okay.
These are real cases, well, from a database.
Got
Real patients with different diagnoses, very diverse diagnoses, and what I presented for one patient, a lady, 80 years, as far as I can recall, 86 years old, sepsis due to pneumonia.
That's fascinating because I see from a different perspective, so it has lots of application for me. So thank you.
Yeah, it can be extrapolated to me.
Yes, right. Thank you, sir.
If not, thank you for your presentation.
Thank you.